Fox 2 Dave Kinchin is live. And Dave, we understand the longer this goes on, the more people right now heading to the ER.
Yeah, that's right. Actually, a member of my family went to the ER last night because of a major headache related to allergies and this smog. And, you know, I've been dealing with headaches off and on over the last few days because of it as well. So reporter involvement, we've all been feeling it here. Many people carrying around these COVID-era KN95 masks to help out any way they can. But if this doesn't work, it's a trip to the doctor or the ER.
With the air quality, headaches, and that's probably the biggest issue I've had, just trying to get a good deep breath of air, but the headache has been the biggest piece.
So Christina Walker's flight out of town will hopefully mean some better air quality once she lands. She's one of countless people across Metro Detroit suffering in some way medically due to the smog caused by the Canadian wildfires, giving us what's been called the worst air quality in the world. Others are looking after more vulnerable family members.
My grandma is living with us and she's wearing a mask when she's coming in and out of the house. So that's one precaution we are taking. For
many, though, getting away from the smoke clouds is not so easy. In fact, more and more people are being forced to hit up their local emergency room or doctor's office to address serious smog-related symptoms, according to medical experts.
Actually, in the last couple of days, it does seem like there are more people who have, as you might expect at this time of year, but probably more with wheezing, coughing, and shortness of breath. People with underlying lung disease, that's who I see, and they get worse.
Dr. Lawrence McDonald is chief of pulmonology at DMC Huron Valley Sinai Hospital in Commerce Township. He says vulnerable people need to take action right away.
If you know you have asthma, if you know you have COPD, have a primary care doctor to make a plan. If you're not on inhalers now, you may need them. You should have them available. There should be a plan for times like this. If you have inhalers and you're on them, you may need additional inhalers. You may need a steroid inhaler. If you're already on all that, you may need steroids. You may need pills or injections of steroids that hopefully you could get at home, but sometimes you need to go to the ER for.
Urgent care centers are also an option, and experts say if you're at home and you spend more time inside, it's probably a good idea. Keep the AC running, keep the air filtered as well, and close those windows, even though it is pretty hot up there, of course, these days. So just some tips that experts say can really help you deal with this smog for the time that it's with us, at least. Reporting live at Detroit Metro Airport, Dave Kinchin, Fox 2 News.
Yes, and you know, we've heard a lot of people who don't even have any underlying conditions that are still feeling an impact with health issues, breathing. We heard that woman with headaches. Now, if they do go to the doctor, what the medical personnel can even do for them at this point?
Well, there's various things that they can give, like various shots and steroids, like Dr. McDonald had said. And one thing, the family member on my side that went to the ER last night, they moved through pretty quick. You know, ERs can sometimes take several hours, 5-6 hours. They were in and out in 2 hours, which is actually pretty quick for the ER. So if there's any good news, people are able to move through. Depending on the condition related to the smog, they can get in and out relatively quickly, again, at least for ER time standards.
Well, hopefully everybody's taking the proper precautions so they don't have to go to the ER. Thanks for that report, Dave.
That's right. Yep.